Are we go?
Yep.
Okay. So I'm sitting here with Dina, who works for the it's the Athens Solidarity Now Centre. Is that right?
It's Athens Solidarity Centre, yeah.
Solidarity Centre. Can you tell us a little bit about that centre?
The Athens Solidarity Centre is a wonderful community place. It serves as a one-stop shop, and people come here to receive services that refer to legal ones, medical, social, employability, and child services.
Right. And so, I mean, there's huge social problems here in Greece. There's huge unemployment,
Yes, indeed,
and lots of homelessness. So what are the typical people that come here?
Well, everybody who's socially or economically excluded, Greeks, non-Greeks, homeless, asylum seekers, refugees, poor, HIV positive people, people living on the streets, ex-prisoners, you name it. Unfortunately, the list is long. But it's not the only problem. We have also to look into the issue of the density of the problems,
Right.
and the fact that people who come here might fall into more than one categories.
Right.
So we have to prioritize the request and see what's, So
for example, homelessness and a drug problem or something.
And being social worker is, what adds to all these kind of difficulties is the welfare state that has collapsed in a way, and we are understaffed everywhere, and the state budget, the first thing that were affected was the health system and education.
Yes.
So if you add all that, with the increased mobile population flow in Greece, refugees and migrants and all that, then you have the picture, and then you can see that this centre is actually a necessity. It's imperative that we have community centres like that.
That's right, and we can't see this on the camera, but I know that we're in a part of town which is very disadvantaged.
Exactly.
And there's lots of homelessness and lots of social problems here. So does the centre turn people away, or because there must be so many, especially with the refugee crisis, so many people coming in? Are you able to meet the demand, or?
Well, yes and no, because we don't want to put our services on sale, okay, or we don't want to jeopardize our ethics and our work. So at the end of the day, we are struggling. But the thing is that we have also developed a referral system. So if people need a service that we cannot provide them, we can refer them to other NGOs and other infrastructures. So that place not only works as a community center within the community, but also makes links and connections with other parts of Athens.
Right. So those networks, those social services networks, are really important to holding together the systems of the collapsed welfare state.
Exactly.
And it's social workers like you that are often voluntarily coming together to fill in the gaps.
Yeah, well, I haven't got a private life, if you ask me like that, and I don't know what weekend means anymore.
So how many hours a week do you work?
Well, if it's 12, it's okay.
12 hours a day?
It's typical, yeah.
That's a typical day?
Yeah, typical day,
Okay, it's a hard life.
I know, but sometimes when you see people that are, they couldn't have gone anywhere else, and sometimes I think that, I feel so proud being part of the civil society and working for PRAKSIS, which is one of the NGOs that work here, is that we offer our services without criteria. We offer our services to people who have been caught, punished for something they are. So being able to help these people and not only deal with a symptom, but also with a cause that they have been excluded, and try also to advocate and work on this kind of full scale of services, at the end of the day it makes a difference.
Oh, it does make a difference, I'm sure. It really sounds like this environment is able to put the social work principles and values very much at the forefront in the process of the
Exactly, and all of the methodology, cases, group, families, community, everything is like, unfortunately or fortunately, a fantastic placement for social workers.
You're an inspiration to social workers all over the world. Thank you so much for doing this video.
Thank you.
Thank you.